This medication is used to help control HIV infection. It contains Cabotegravir and rilpivirine, which work together to decrease the amount of HIV in your body so your immune system can work better. This lowers your chance of getting HIV complications, such as new infections and cancer, and improves your quality of life. Cabotegravir is an integrase inhibitor, while rilpivirine is a non-nucleoside reverse transcriptase inhibitor, NNRTI. Both drugs block the virus from growing and infecting more cells. It's important to note that this medication is not a cure for HIV infection. To decrease your risk of spreading the disease to others, continue to take all HIV medications exactly as prescribed by your doctor. It's also important to use an effective barrier method, such as latex or polyurethane condoms or dental dams, during sexual activity as directed by your doctor. And, of course, do not share personal items, such as needles, toothbrushes, and razors, that may have come into contact with blood or other body fluids. If you have any questions or need more details, consult your doctor or pharmacist. Before you start using Cabotegravir/rilpivirine, it's important to understand how to take this medication. Your doctor may have you take the oral forms of Cabotegravir and rilpivirine for at least 28 days to see how well you can tolerate these medications. Once you are ready for the injection, your doctor will administer this product into a muscle, usually in your buttocks, once every month or once every 2 months. The dosage will be determined by your medical condition and how you respond to the treatment. It's crucial to follow your doctor's instructions and keep using these medications as prescribed. You may find it helpful to mark your calendar to remember when to take your medication. If you miss a planned monthly injection, be sure to contact your healthcare professional right away to receive further instructions for your HIV treatment. If you experience any injection site pain, swelling, redness, itching, or bruising, it's best to consult your doctor. You may also experience headaches, tiredness, nausea, or trouble sleeping, but these symptoms usually go away on their own. Sometimes, after receiving the injections, you may experience temporary symptoms such as sweating, shortness of breath, stomach cramps, dizziness, or mouth numbness. These symptoms usually stop within a few minutes, but it's important to tell your healthcare professional if you experience any of these symptoms soon after receiving an injection. As your immune system gets stronger, it may start to fight off infections you already had, causing disease symptoms to come back. It's also possible for your immune system to become overactive, leading to symptoms such as unexplained weight loss, severe tiredness, muscle aches, headaches, joint pain, numbness or tingling, vision changes, signs of infection, signs of an overactive thyroid, signs of Guillain-Barré syndrome, or signs of liver disease. It's important to seek medical help right away if you experience any of these serious symptoms. It's important to be aware of any changes in body fat while taking this medication, and discuss the risks and benefits of treatment with your doctor. Rilpivirine can cause a rash, so it's important to seek medical help if you develop any rash. Additionally, if you notice any symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing, it's important to seek medical help right away. Remember, this is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed. Before taking rilpivirine or 600 mg per 2 ml, 300 mg per milliliter, in suspension, extended-release antiviral-HIV, antiretroviral, non-nucleoside RT inhibitor, it's important to let your doctor know about any allergies you have, as this medication may contain inactive ingredients that could cause allergic reactions. It's also important to discuss your medical history, including kidney or liver disease, and any mental or mood disorders with your doctor or pharmacist. If you are pregnant, it's important to talk to your doctor about the risks and benefits of taking this medication, as it can lower the risk of passing HIV infection to your baby. If you are breastfeeding, consult your doctor before doing so, as it is unknown if Cabotegravir passes into breast milk and rilpivirine does pass into breast milk, and breast milk may transmit HIV. Before having surgery, make sure to inform your doctor or dentist about all the medications and herbal products you are using. As for the daily dosage and optimal timing, it's important to follow your doctor's instructions. They will be able to provide you with the best guidance on when and how to take this medication for the most effective results. It's important to be aware of how this medication may interact with other drugs you are taking. Always keep a list of all the products you use and share it with your doctor and pharmacist. Do not use this medication with any other products that treat HIV infection, or with products that contain Cabotegravir or rilpivirine. Certain medications can affect the removal of Cabotegravir/rilpivirine from your body, which may impact how this product works. Examples include apalutamide, dexamethasone, enzalutamide, certain macrolide antibiotics, rifamycins, St. John's wort, certain drugs used to treat seizures, and a certain combination product used to treat chronic hepatitis C, among others. Always consult with your doctor before making any changes to your medication routine. If someone has taken too much of this medication and experiences severe symptoms such as passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of an overdose may include a fast or irregular heartbeat, severe dizziness, or fainting. It's important to seek help right away if you or someone you know has taken too much of this medication. It's important to have regular medical tests while taking this medication, including tests for viral load, T-cell counts, and liver function. Make sure to keep all your medical appointments and consult your doctor for more information. Make sure to take this medication exactly as prescribed by your doctor. If you happen to miss a dose, be sure to consult with your doctor or pharmacist to determine the best course of action for your dosing schedule. This medication is typically administered in a medical setting and should not be stored at home. It is important to follow the guidance of your healthcare provider regarding the use of this medication. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.